Today we're going to be reviewing Zomacton with my patient.
Hi, I'm Morgan and I'm going through fertility treatments.
So for Morgan's injection, we're going to be using Zomacton. Also, we have here Omnitrope. They're essentially the same thing, just different manufacturers. So upon receiving this medication, Morgan, of Zomacton, it does need to go into the refrigerator, okay?
Okay.
And it also needs to go back also after using it each time, okay? So it stays in the refrigerator. All right, so you're going to open up your box of Zomacton, and you're going to see inside that you have a powder and a liquid vial. Okay. So you're going to take your liquid vial out from the packaging, and that's just regular water used to dilute the powder. So you're going to have leftover liquid in there, and that's fine. Don't be alarmed, okay? It's just going to get discarded. You also have some additional supplies that you're going to need to find as well. So you're going to have a 3 milliliter 22 gauge needle syringe combination. It's going to be labeled used to mix and draw up Zomacton. Then you're also going to have a bag of orange capped insulin syringes as well. Okay, and this is what you're going to be using to inject the medication. So from here, the first thing that you're going to do is you're going to take the safety cover off of your liquid vial. That never goes back on. You're going to take out an alcohol swab, and you're just going to clean the top of the vial before each use, okay? From there, you're going to open up your 3 ml needle syringe combination from the package that's labeled used for mixing and drawing up, okay? And for your dose, you're going to pull back till you have 1 milliliter of air inside of the syringe, because you're going to be using 1 milliliter of liquid, and it's always equivalent to the amount of air we're drawing up, okay? So from there, you're just going to carefully uncap your needle, and you're going to go into your liquid vial, and below the level of the liquid, you're going to dispense that milliliter of air by pushing on the syringe, okay?
Okay.
From there, you're just going to turn the vial and syringe upside down together, and then you're going to pull back on that plunger till you have a milliliter of the liquid inside of the syringe, okay?
Okay.
And then you're going to turn it right side up. You're going to remove the needle from the vial. This vial gets discarded. Then you're going to carefully set this needle down for a moment while you open up your powdered one. So once again, pop the safety cover off. Clean the top of it with an alcohol swab. So you're going to insert the needle into this powdered vial now.
Okay.
And then you're going to push on the plunger to dispense the milliliter of liquid into our powdered vial. Okay? And then from there, you can remove the syringe and needle, and this goes into the sharps container. You're going to pick this vial up, roll it back and forth between your hands. You're going to take a look and make sure that all the powder has been dissolved into the liquid, okay? After you roll it back and forth for about like 15 seconds or so. Then you're going to open up your orange capped insulin syringe that was labeled for injecting, okay? And your dose for yours, I believe, was 20 units. So you're going to pull back till you have 20 units of air inside of the syringe. Okay, cap the needle. You're going to go straight into this vial now. Push to dispense the 20 units of air into this vial. Turn the vial and syringe upside down together. And you're going to pull back till you have 20 units of the medication inside of the syringe. Okay, turn it right side up. Move the needle from the vial. This vial would go into the refrigerator now. After you've withdrawn your dose, you're going to carefully set it down and recap it for a moment. And so the area that you're going to be injecting the Zomacton into is your abdomen. You're going to go 2 to 3 inches away from your belly button, either to the left, the right, or below. Anywhere in that U-shaped area you can inject, okay? So once you select your site, you're going to clean the skin with an alcohol swab. You're going to uncap your needle. You're going to pinch the skin up to create a pocket-like pouch for the needle to go into. You're going to go straight in with that needle all the way in at 90 degrees. Push on the plunger to dispense your dose. Hold it there an extra 5 seconds just to make sure you got everything. Remove the needle from your body, and that whole thing goes into the sharps container.